Hello, good morning, good afternoon, wherever you are. It's 11:30 here, so if you are not in Las Vegas or on the west coast of the US, good afternoon. Hi. I am continuing the conversation of why your anti-inflammatory treatments aren't working for your pain, for your knee pain. So yesterday I told a story about a client of mine, Melissa, who was going for years and years and years with cortisone injections, and they eventually stopped working. So if you want to check out what I talked about with why the cortisone injection stopped working for her knee pain, that is yesterday's video. So head on over to that to look at why the cortisone injection stopped working. So continuing the conversation of Melissa with this ongoing knee pain, doctors telling her it's meniscus problems, arthritis, tendonitis, what is it? All she knew was that the cortisone injections worked for a while and then they stopped working. Then the doctor told her, you know what? You're going to need a knee replacement at some point. You're too young for it. You need to wait until you are 65 or 70. You need to wait until you're older. So for her, that was going to be like 20 years. So the doctor said, just continue taking your anti-inflammatories. She used ibuprofen. That's what worked for her. And so she continued doing that. And then the ibuprofen stopped working. So her knee pain was still there. And, she was taking 2 ibuprofen a day for a while, months, years, and it was working very nicely. And then all of a sudden, it doesn't work anymore. Now what's she going to do? Because she needs to do something. The cortisone doesn't work anymore. Ice certainly doesn't touch it. And the ibuprofen worked for a while. So what she didn't know was that her body had gotten used to the dosage. So what do I mean by dosage? Dosage is the amount of the chemical, the medication that you're putting in your body. So the dosage is 1 pill or 2 pills, 50 milligrams, 100 milligrams, 1,000 milligrams, however many milligrams or however many pills you're taking, that's the dosage. And then the frequency is how often you take it, as needed, daily, twice a day, 3 times a day, so on and so forth. So typically, people will take 2 pills of ibuprofen. That, the bottle typically says take 2. That gets you your dosage. So Melissa was taking 2 once a day. That was working really well. And then it wasn't. So what happened? Well, she built up a tolerance to the ibuprofen. What does that mean? Well, building up a tolerance to something means that you need more of the chemical, more of the medication to get the same effect. So that would mean she's taking 2 pills. 2 pills isn't enough. So she could up it to 3 pills or 4 pills, or maybe she takes 2 pills in the morning and 2 pills in the evening. So it's a total of 4 pills to increase the overall amount of the medication in her body. The 2 pills of ibuprofen, her body got used to that and it no longer was helping her knee pain. So that is sometimes an option. I don't tell people how much medication to take. That is outside of my scope of practice. So I can't say to take 2 pills or take 4 pills or take 6 pills. All I can tell you is that for the pain relief, sometimes you've hit your tolerance and you need to up the dosage. And then you talk to your physician or your other medical provider who can prescribe medication to ask how much to take. I will say, going through my pharmacology courses through physical therapy school, pain relief from a pill requires a lower dosage. Anti-inflammatory relief from a pill requires a higher dosage. So you could be getting a pain relief effect if the pain is caused by not inflammation, or it's caused by low levels of inflammation, but then that inflammation increases, and to knock out the inflammation, you need a higher dosage of the anti-inflammatory to knock out the inflammation compared to just getting pain relief. Okay, so pain relief dosage is low, anti-inflammatory dosage is high. And that's based on how the medication works in your body to knock out the inflammation. Okay, so that's ibuprofen. That's an anti-inflammatory drug. Now, I say ibuprofen because that's what Melissa used, but really anti-inflammatory include aspirin, ibuprofen, Motrin, Advil, Aleve, naproxen, and there are others. Those are over-the-counter ones. There are also prescription ones like diclofenac, and there are other ones. They all work in similar ways to get the anti-inflammatory effect. So how do you get rid of the inflammation? Let's say, now this was not the case for her, but let's say Melissa couldn't take any more ibuprofen. She had stomach upset with the amount of pills she was taking, because that's a very common side effect, having an upset tummy with the ibuprofen. And that's based on the inhibitors, the COX-1 inhibitors that the ibuprofen latches onto in the stomach. COX-1 is throughout your whole body, including your stomach, whereas COX-2 inhibitors go to the can't use my words today. The COX-2 inhibitors go directly to the joint themselves. They don't line the stomach lining. So, but what if you do have this stomach problem, you do have tummy upset, what can you do? Well, taking a higher dosage, that's also going to increase your stomach upset and could cause more problems down the line. So what can you do? Well, you know, you're in pain, you can't run anymore, you can't exercise, feel like you're going to get worse if you don't get a handle on it, feel like you're going to get worse if you can't get out and exercise. So one of the first things I have people do when they're trying to control their inflammation, they can't take more medication, is they control what they're eating and drinking. So the first thing that I tell people to do is get rid of the sugar, eliminate the added sugars, don't cook with them. Check your ketchups, check your barbecue sauce, check your taco seasoning. You think that it's just spices? Nope, there's sugar in there, and every little bit adds up and every little bit counts. Do I recommend that people are sugar-free forever? Maybe. You never know until you try. So you get rid of the sugar in the beginning, have it gone for 4 to 6 weeks, and then if you feel like you could potentially tolerate a little bit more and it not flare up your inflammation, you add little bits here and there. Some people can never add back in sugar and some people can. It all depends on the person, but I do recommend that. So if you can't take more anti-inflammatory pills because of side effects, look at what you're eating and drinking. And the first thing I recommend is to control and get rid of that added sugar. And then also looking at your bad fats and your trans fats, getting rid of those, getting rid of the processed foods, which really the processed foods are either just made up of chemicals, right? Or they're chock full of the sugar and the fats, the bad fats. So that's what makes them taste so good. But you can make good tasting food without sugar and without those crummy fats. I do it every day. We cook in, I say we, that's a funny story because I cook in my house. So I cook gluten-free, mostly dairy-free, refined sugar-free. The only sugars we cook with are raw honey, pure maple syrup, or coconut sugar. And we do gluten-free because my husband has celiac disease. He has to do that. We cook mostly dairy-free because we thought for the longest time that he had a dairy allergy. So we got used to cooking that way. Now we add in some dairy because it's not actually a dairy allergy, but a nightshade allergy, and he can't tolerate white potatoes, and potato starch is often used in shredded cheese, to make it not clump. So we realized that, and he can have some, we do have some cheese, but we still overall limit it. And then we use unsaturated fats. So we're using extra virgin olive oil to cook with instead of vegetable oil. Now, those are both liquid, but the vegetable oil works differently in the body than the olive oil does. So long story short, get rid of the refined sugar, get rid of the added sugars, get rid of the bad fats and the trans fats. If you can't take the anti-inflammatory pills because you've topped out at how much is working for your pain relief, but you can't tolerate it because of the side effects, the tummy upset or something else. So that's it for today. Tomorrow, I am going to continue on why your anti-inflammatory treatments aren't working and continuing on with what to do instead. So look for that. I will talk to you guys later. Have a great rest of your day.